Kenya, my motherland. In this country, there was born a power woman and a powerhouse. My name is Miss Mweni, and this is my YouTube channel. Welcome. Good morning, Kenyans. I hope you're taking good care of yourself during this time of COVID-19 and keeping safe wherever you are. My name is Miss Mweni and welcome to Miss Mweni TV. Right with me here is Dr. Mungai, Professor Mungai. Or should I call you Professor Dr. Mungai?
I'm okay with whatever. I'm a doctor. I teach at the university as well. That's my job. So, yes.
So right here with me is Professor Mungai. Welcome on board, and we are here to discuss and exchange ideas on during the COVID-19, during this pandemic, which is no longer a pandemic, it's endemic. How do we survive? How do we give hope to Kenyans and the frontline workers? Those are the doctors. So he'll be relating with us towards that, and we also have a campaign that is coming up, and he's the one who is spearheading the campaign together with other doctors. So we want to find out from him more about the campaign and how we're going to go about it. So karibu daktari.
Thank you very much.
So in brief, can you tell us who Professor Mungai is?
Professor Mungai Ngugi is my name. I am a surgeon. I am a urologist. I'm from the University of Nairobi, the Department of Surgery. I also head the East Africa Kidney Institute of the University of Nairobi College of Health Sciences.
You are a urologist.
Yes, I'm a urologist. Yes.
And during this time of this pandemic, has your clientele been affected? Do you still get the numbers? Because I know you're one of the best urologists in this country, national-wide. Eh?
Good, you're pampering me, that's
Yes.
okay. And it is true, but urology covers a group of people who would be very vulnerable.
Yeah.
Urology patients, like for the men and women, tend to be the elder population, the people who are older than 50 years. And that group is very vulnerable, everybody is aware. It's very vulnerable to COVID-19, and many of them are afraid of even leaving their houses to come and seek help.
Yeah.
Unfortunately, the diseases that they have, if neglected for a long time, will end up killing that population. So early interventions that would have been done to prevent the diseases that they have means it's not going to be done, and without early intervention, because of the fear of coming to hospitals, then they're lost. And of course, the other challenge for these people is not just that when they come to the facilities they'll be infected, but when they get affected, then they're difficult to treat.
Okay.
And so they're very scared, and many of them are staying at home. The number I'm going to see after this, we can't afford to be going to everybody's house to go and sort them out. And we've got to arrange a way of them coming to see us.
So you feel like there's a scare?
There is a scare, but it's not just a scare. It's not an empty scare. It is real. They can get infected as they come to see us. How is somebody going to come from Mombasa to Nairobi or whatever to be seen by urologists using public transport without getting COVID-19 en route? And so that becomes a challenge, and they may very well get it en route and therefore die from the COVID rather than the disease for which they've been getting care. So that's a challenge that we've got to deal with, and one that we've probably not been able to address properly, because we've looked at everybody as being the same.
Okay.
They're not the same, they're not like the small children. They're very vulnerable.
So how are you as a doctor managing their whole season?
As in managing these patients with COVID-19, of course, if you have a reception, you've got to change that.
Okay.
Because they can no longer come and sit next to each other in a crowded fashion. So that has to change. So the space available has to change.
Okay.
Not just that, when they come, they're going to use one door, but they cannot come and crowd at the door as they get here.
As a doctor, what kind of mask? And your patients, because it's a very special, it's a special group of clientele that you have.
Exactly.
Yeah, so do you just advise them to be on the right mask, or what kind of mask are they supposed to be on?
You don't even know whether they'll get those masks. Whether the best mask for a patient who's coming to see you in a place that is likely to be having so many people is the N95.
Okay.
Certainly you as the physician or as the doctor, you must have an N95 mask. They're expensive.
How much is one, by the way? So
Minimum,
for knowledge of our viewers.
minimum 2,500.
Wow. During this time, okay.
Yes, 2,500 is the cost of the N95 mask, and you wear it. There are questions of the safety of using the same mask with the same patients for a long time. And how do you re-clean this mask?
Yes.
How do you get to reuse this mask? Because it was supposed to filter the virus away from you and even from you to the patient. So if you're going to reuse it, which you said you can, how safe is it to reuse this mask? So in an ideal setting, you should probably throw away the N95 mask at the end of the day.
Okay.
That is what is safest.
And it's 2,500.
Yes. So that is, if you can't do the maths, you're close to 60,000 to 70,000 shillings.
In a month?
In a month on mask.
Wow. The other day, we just lost the gynecologist, Dr. Doreen.
Yeah,
I know you might have known her.
Yes, I do.
Yeah, so, and this is now home for you? Because you
yes, it downs on us,
and
this is critical because now we've only been hearing of health workers dying elsewhere.
Yes.
And now here we are having health workers dying of a disease while taking care of patients. And the healthcare worker may not be able to avoid contact with the patients. So the protection. Imagine yourself going to see a doctor who has a PPE. You'd run away.
It's a bit scary.
It's a bit scary to see a doctor who's wearing a PPE. You don't even know who he is. So we necessarily have to open up with, we may put on the N95 mask as the minimum, wear gloves. But then in my examination, for instance, I cannot be 1 meter away from you. The examination includes looking, touching, manipulating, and even sometimes looking inside the mouth. And the viruses are being shed from the mouth. And while I may if I'm coming very close to the mouth, I may need to cover my eyes because covering the nose and the mouth is not enough. And then after we've done that, maybe I need to cover the entire face because. So depending on the level of examination that we need, the PPE requirements are different. If you're going to have a patient that you're telling, kohoa mwananchi, like we always ask people, cough for me to see the back of your throat. I'm asking the viruses to come from the pharynx to me. And so am I going to avoid telling the patient to cough? Then I won't be able to see the inside of the mouth. I won't be able to evaluate the patient's color of the tongue, what is on the tongue, what is in the mouth, all those things. So the intensity of the examination may change a little bit during this time. But there are people who cannot avoid examining, and there are times when even you as a doctor cannot avoid that examination. So then you keep on raising the level of the PPE that you have when you're doing that patient.
So that brings me to this point. So you are spearheading a campaign for doctors.
Yes.
And the hashtag is save a life, save a doctor.
True.
Yeah, and what derived you to this agenda, you and the College of Sciences?
The College of Health Sciences is in charge of training all the doctors that are under training at the University of Nairobi in Kenyatta National Hospital. That is 80%, 90% of the doctors that treat people at Kenyatta National Hospital. There are people who are in training, one form of training or the other. Remember, when you go for treatment, you assume you have paid for your care. But this doctor is not paid for the attire that he's going to need to see you. True, we've reduced the levels of activity because of this, but we cannot reduce this level of activity forever. We have trainees. Some of the trainees are actually paying their own school fees to be at the university, to come and treat you. They're paying. And so you cannot ask them to have the burden of spending 2,500 every day to buy a mask, just the mask, in addition to the gloves, in addition to the sanitizers. So we've got to have a way of funding these people. Now, those are the postgraduate doctors, and that is going to be a very big challenge. If you do not provide them with the PPEs, then they will end up dead.
Okay.
You'll have lost a generation of doctors.
Young doctors.
Of young doctors in their 20s and 30s.
Yeah.
Those are the people who do the bulk of the work in the hospitals. So we've got to protect these people. And from available evidence, as much as even today, we are being told that even having been infected in the past does not prevent you from being reinfected again. Which means that even if we had a vaccine, even if you were vaccinated, you could still get the disease again. So, even if you had people who had infection, you can't tell them to go back. Because every time he's seeing patients, he is at risk. What about the care worker who is at the accident emergency department? Everybody coming there. This is the flu season for us. They're going to come coughing. They're going to come sneezing. They're going to come vomiting. What do you do? Through the doctor, we'll have the PPE. But you know, we are not used to that. You know, this is new. So that you're having to worry about yourself. Not just the patient. You have to worry about yourself.
Because you used to worry about the patient.
You used to worry
about vis-a-vis.
You've got to worry for both. You've got to worry about yourself. You've got to worry whether you're going to survive. You've got to worry about what will happen to the patient. And so, but your instincts, your training has been you rush to the patient. You know, a long time ago, we even used to do mouth-to-mouth resuscitation. You know? Now, of course, that is not possible. But then you have the bags that we can use. And sometimes the speed at which you're going to do does not allow you to prepare sufficiently. So that's a challenge. In the intensive care unit, these patients will be having the disease, they're coughing, you'll have your PPE, and you must change between patients. So the level of care, if one patient, one doctor, or one healthcare worker, because if you move from one to the other, then you're now spreading the disease from one patient to the other. So the PPE care is one big challenge. But in addition to that, something else we were discussing this morning in a webinar of that response team is how do you get to support these doctors psychologically? What does this doctor feel when he's going home? Is he worried that he has a disease that he's going to take to the family? So this disease has brought a new dimension for you as a healthcare worker, that you may contract it from the people you're taking care of, and the moment you contract it, the moment you become positive, you'll be removed from them. And then, like Doreen, you go to the hospital and there is no bed.
What? And you're a doctor.
And you're a doctor. There is no bed for you, so you've got to go scampering for beds over the city. Or worse still, there is no money to pay for it. Who pays for you if you are a doctor and you're in a public hospital and you get the illness? Who pays for you in the best facilities available? So, how does that affect you? The fact that you could die from the disease and the country might just let you go.
I think death does not choose. And I feel it breaks my heart to see that people like you, or let's say people like me, we have a mandate and a role in this country to make sure that our doctors are safe and they're well when it comes to matters of hospitality, when it comes to matters of being them safe in terms of the PPEs. Because I'm seeing the frontliners like the COVID committee going with the issues of donating PPEs all over the counties. I've seen Mr. Guru from Simba Cement doing the same, and with his committee. So and I think now it's high time, because if they knew like someone like Doreen would die because of such a disease, then how many more people who are in the village, like in hospitals in the village, might be at risk, just like Doreen.
Imagine like this. It's true, Ruth. Imagine this is a young girl. She's 38.
Yeah.
There are others who are older than her, like me. What is the risk of going to the hospital? What is the risk of seeing patients? And yet we have a duty to see these patients. How does this country take care of the doctor? We have obligations to this country. What are our privileges? We've got to raise funds for the privileges of these frontier care workers. Because believe me, if they disappear, the patients become the front line.
Yeah.
So we've got to be careful that we do not let the patient become the front line. These young people, and even the other older ones, are willing to take care of the patients. But we've got to make sure that there are facilities for them. There are facilities for them to take care of themselves and their family. These are not trained soldiers, they are trained doctors. And we must take care of them. We must look for a way of taking care of psychology. When they are in the hospital, who feeds them?
Yeah. And who takes care of your family?
Who takes care of your family?
Yeah.
How do they go home?
Yeah. And
Like,
for those that don't have places to stay, where do they stay?
If you're staying in a very far away place where it is risky to go, how do you go?
Yeah.
And yet you're a front line.
Is there such a plan? Because you've been in this industry for long.
There is no such a plan. The doctor took his Uber if he want, of course. And the doctor then reaches where he's reaching and takes a boda to his house, because that's what they are. And so
They're here in big title doctors.
they're in big titles doctors, and they are doctors at heart. They have big titles at heart, but they don't have a big title in the pocket.
Okay.
And that's the challenge. But then I think we can change that narrative.
Yeah, so how do we change that narrative? That's the question. And what's the plan?
The change of that narrative is to provide for these people as the best that we have. Provide for them so that they do not have to compromise seeing patients. They are likely to compromise when they think the patient is at risk.
Yeah.
So they don't. So the personal protective equipment must be of the highest caliber, but we must also think of how they feed when they're in the hospitals. Who feeds them? Don't keep him hungry still from morning till evening. And also, how does he take care of the family back at home? We're not asking for much. We're just saying that we need to help the doctors feel wanted. And when we talk about the doctor, it's not just the doctor. It is all the healthcare workers. In fact, when you come to hospitals, nurses stay with the patients more than the doctors.
Yeah, sure, I agree.
Yeah, so we need to take care of that group very, very well. But they are not just those ones. You also have the people in the laboratory. There are people who are taking these samples. There are people who are wheeling these patients. There are people who are feeding these patients. There are people who are driving these patients in ambulance.
Who are cleaning the hospital.
And people who are cleaning the hospital, who must be afraid of this disease. Yes. So we have to plan a way of making sure that we keep them. Without them, we are a country without soldiers.
True.
So we've got to look for that in the best way possible.
So as we wind up, being a doctor, how does it feel when you lose a life in your line of profession?
That's the one thing that hasn't changed in my 35 years of practice. That every patient that you lose is painful. I know there are Kenyans who feel that the doctor didn't do their best. And it is human sometimes to not be able to do what was expected. But the majority of doctors will be doing their best. And every death, every loss, because even some losses that are not necessarily deaths are still as painful. And there are times when we know, like for me, as a urologist, somebody comes to you, they've got a cancer, and you know they are responding very well, and they feel nice, and you feel nice, but you know after a time, it's coming back. That troubles you, and when it does come back, it troubles you even further, which is why we do research to try and see whether we can keep patients as alive for as long as possible.
Wow. Hey, that was good insight. I think we need a take two of this. Thank you very much. And so we are going to launch the doctors campaign. Maybe just in 1 minute or something, tell us where we're going to start and what is needed and what you'll urge Kenyans how to do the donation, and where they'll get more details about this. And I can also maybe fill in that when I'll be winding up.
Very well. Like we have this committee of the COVID Response Committee of the College of Health Sciences. It is led by one Professor Joyce Olenja from the Department of Public Health, but she's the head of this committee. We are raising funds. We are conducting research. We have a pay bill number which you will tell them. I can't read it off head. There's a pay bill number through which people can contribute to this committee, so that this committee can use those funds for purposes of providing for our doctors, those in training and those who have already trained. We have many trainee doctors at the Kenyatta National Hospital, close to 1,000 doctors who need all this kind of equipment. And then we're even planning to open the school.
Wow, in September?
About September, we think we can open for the other students. You imagine that will provide with an even bigger problem. The medical students, the dental students, the nursing students, all those will need care. And we have no way of providing for this. To ask the parents of these students to be able to provide for them might be an impossible challenge. Even as we plan to do this, therefore, we will need the funds that this country can marshal to train and continue providing a service and research in our country.
Wow, thank you very much. So finally, to somebody out there at home, what is your message of hope?
Yes. Well, all I've talked about for the last 30 minutes is death. We've talked about death and how people are going to die. God is with us. Let us start with that, that God is with us. And even as we spread the message of how important it is to care, and that is why I'd prefer physical distance to social distancing. We must be socially close to each other. We must tell each other and encourage each other. And that is the one project that was going to be started today in the university by one Professor Madai. She was discussing it this morning. And it is to support the healthcare workers in Nairobi so that they can get psychological support. Somebody would make a telephone call to them and tell them, we take care of you, we look after you. You see, the people of Nairobi do not know how to call doctors. I've seen in America where people drive around doctors' homes telling them, thank you for what you have done for us. We want to have the doctors feel appreciated and to know that the country is behind them as we fight this pandemic.
So, in a nutshell, I want to say thank you very much for tuning in to Miss Moini TV to listen to such positive insights and a beautiful discussion with Professor right here. And we'll be back with a few other doctors, those who have been affected by COVID-19 and those who are also supporting different types of categories of people. So, I love you. It was nice catching up with you. May God bless you. Until next time, stay safe. And remember to wear your mask, especially for those with special conditions, just like as our professor has said. Make sure you wear an N95. That's all I'll say. And follow the health ministry's directives. Bye. Ciao.